When you throw away money on wasted electricity, you're throwing away everything you could have bought with it. Saving energy saves you money. Learn more at EnergySavers.gov.
Welcome to this edition of Lancaster Perspective. I'm Mike Miller, my special guest today from FairHope Hospice, Susan Nixon-Stoughton, who is a community development coordinator. How you doing?
I'm wonderful. How are you?
I'm doing well. Long time no see.
Yes, we seem to show up at a lot of the same meetings.
Yeah, it's the same chamber meetings and all those type of things. But how you doing?
I'm wonderful. Yes, just
enjoying summer.
I am. Have a new grandbaby, so that's a lot of fun.
Fantastic.
Yes.
So getting to do the diaper change, all that stuff?
Oh, we have her at least once a week. But closing in on 10 months old. But yeah, we've had a lot of fun.
Really?
Yeah.
Wow. Yeah. Now, is Tom involved in all this?
Oh, you know it. And of course it's a granddaughter, so another girl for him. But yes.
Yeah, absolutely.
Yeah, he said even our dogs are female. Come on.
I live with 4 women. I know what you're talking about.
You understand.
Yeah, I told somebody that one day. I said, four. So we have 3 daughters and my wife.
Yes.
Oh, it was funny.
Yes.
But, a lot of stuff going on in the community. FairHope Hospice and palliative care. And I know we talk about all the services, but the difference between palliative care, hospice, and understand it's competitive. Which I didn't know.
Yes. There are for-profit hospice and there are non-profit hospice. And in the best interest of the patient, they need to understand that, first of all, that you have a choice. And in Lancaster, Fairfield County, we service as far down as Athens. I go over into Circleville, Rick's over in Perry County. We've even gone over into Muskingum, and then I cover Licking, parts of Franklin. So we're in a lot of areas, but I think kind of the misnomer, people use the word generically, it's hospice.
Right.
And that couldn't be further from the truth. If you want to stay local and you want local care, you need to request FairHope Hospice and Palliative Care. And basically, we are a nonprofit, so certainly if you have a hospice benefit on your insurance, we will bill it. However, if we bill for $100 and your insurance pays $50, you'll never receive a bill for the other $50. So in cases where there's certainly loss of life at the end, the family doesn't have to worry about being strapped with a bill at the end. And there are for-profit hospice, and the best story I've heard since joining hospice nearly 2 years ago, it was a physician, and they had just referred her mother to a hospice, and the hospice name that they mentioned, the social worker said, well, be prepared to sign over everything your mother's ever owned. So it's, people just need to know that we are a nonprofit. And certainly we do everything we can to keep the patient at home, wherever home may be. And I know we've skipped from palliative straight into hospice, but whether that's an assisted living, if it's a nursing home, if it's home, or even a loved one's home, we're going to do everything we can to keep a patient at home.
Now, when people talk about the location where you're at, I know it's off South Road, but can people come through? Can they make appointments? Do they need to be referred, I guess, might be the...
If you're interested in seeing the Pickering House, you could pretty much stop by Monday through Friday, 8 to 4, and there's going to be somebody there that can give you a tour. Certainly we're there 24 hours a day. However, during those off hours, it is clinical staff. We do have a 12-bed inpatient facility, and it's very important to us that we keep the clinical staff focused on what they're there to do, which is deliver quality patient care. But certainly people can stop by, and that has happened. I've taken many folks a tour myself that maybe have a loved one getting ready to the point where they need to sign on to hospice care, and they want to see what we're all about. And again, we do have that 12-bed inpatient facility, and if my goal is that I want to die at home, but then I go into a pain management crisis, then I can come up to the Pickering House. I can spend 2 or 3 days there. We have 5 5 medical directors that all have a different area of expertise. They can get my pain managed, and then I can return back home. So, or in the case that somebody doesn't want to die at home, then they have the availability to come to the Pickering House. Each room is decorated individual of the next. It gives family a lot of privacy, and they literally can treat those nice-sized rooms as their home. I've been there before, and I've seen 4 or 5 rollaway beds kind of shoved into the room, but we encourage family to come and stay and make the Pickering House their home for whatever period of time they may be there.
Now, people talk about, I don't know the paperwork to fill out. I don't know, what am I supposed to do? I don't, mom needs this or that, and I'm just not, what is there, I guess, I want to say programs, or?
It's a loaded question.
That's why they pay me the big bucks.
There you go. Let's start in the very beginning. A chronic illness that you're diagnosed with, and a doctor has told you that you have cancer, and that maybe you have, at best guess, because no doctor really knows, and they'll tell you that, of what the disease progress may take. So with having 1.5 to 2 years, and you want to receive chemo or radiation, you want to go after life-saving treatments, then you sign on for palliative care.
Okay.
With palliative care, you'll receive a nurse visit maybe just once a month, but it's that extra set of eyes and ears that can really work with the whole picture. But during that time that you're in palliative care, you're still receiving life-saving treatments, but we're able to help. Maybe it's with that pain management and help get that under control. Certainly that's when we send in bereavement. And to answer your paperwork question, from the time that we receive a referral, and anyone can make a referral. I could make the referral, a doctor can, a neighbor can, anybody that sees that there's a patient that is in need, they make the referral to us.
It doesn't have to be a family member.
It does not have to be a family member, no. And many times we don't have family members that even live in the same state. So it will be somebody that can make a referral for someone else. At that point in time, it's up to FairHope Hospice to go ahead and check with that physician to make sure that the physician's on board with signing them on, be it the palliative side of what we do or the hospice side.
Right.
So if you come on with palliative, and let's say that the doctor's saying you've got 1.5, 2 years best guess, and you want to sign on for palliative, and maybe you've gone through just about as much treatment as you can stand. At that point in time, if you're not going to seek any further aggressive treatment, then you can turn over to our hospice side, and you can just sign on to hospice. At that time, we may have a nurse out to see you once a week. We could have a nurse out there every day, depending on how the disease progression is moving. And at that point in time, the goal is to keep you comfortable.
Right. If you're just tuning in to Lancaster Perspective, I'm Mike Miller, my special guest from FairHope Hospice, Susan Nixon-Stoughton, the Community Development Coordinator. If people have questions, website to go to, or just easier to call?
Well, you can go to fairhopehospice.org, or you can call 740-654-7077, and certainly we have folks there that can help. I encourage folks, if they want to come up to 282 Sells Road and take a tour. The Pickering House is built on about 40 acres of land. There's a natural waterfall on the back of the property, and last summer we had a shelter house built, and it's accessible by if a patient's in a hospital bed and they want to be wheeled out there, a wheelchair. We have a gator if we needed to help get somebody back there.
Wow.
So that they can go back and really enjoy the beauty of the property. And it is not unheard of on a daily event to have deer walk right up to windows. Last summer I called them the Fox family because we had mom, dad, and a baby. And so there's just lots to see there, and it's extremely peaceful.
Now, I know you've been involved in the community for a long, long time.
Wow, you're implying I'm old.
No,
long time.
I didn't mean it that way. Did you think years ago this is what you'd be doing?
I didn't. And the way that this all came about, I myself am a breast cancer survivor and went through 4 surgeries in 18 months. And Denise called to check on me one day to see how I was doing. And I had surgeons and a physician saying, you really need to reduce your stress. And, when you run an agency, and at that time I was, There's a lot of budgeting concerns, which, kept you up at night. At my job, working at the time where I was on call 24 hours a day with stuff that just happened, running 2 counties, and it was a lot. And so she and I met, and when I was released to drive, and we talked about, could I make a difference in what Denise's mission was with FairHope Hospice and palliative care. And certainly did it make me maybe a little more compassionate about what I do, because I've had friends that their outcome wasn't the blessing that I've had. And those friends, and since starting on July 11th, I will be with FairHope Hospice 2 years.
Congratulations.
Thank you. I've had several friends who, one in particular, she said she wanted nothing to do with any hospice, and she ended up signing on, and then she wanted nothing to do with coming to the Pickering House. And she came, and at the time that she arrived, the doctors said they didn't give her till the end of the week. But because the doctors really worked with her and got her pain managed, not only did she rally to have a couple of more weeks, they were important weeks, Mike, because she was able to celebrate her 25th wedding anniversary.
Fantastic.
So there are just so many stories that go on that are probably too numerous to share. But and I have to give Denise credit. For those of you who are questioning Denise Bowers, the CEO at FairHope Hospice, she encouraged me when I first started there to really spend time with patients, and then I would have my own stories to share. And little did I know that I would fall in love with a man that was a grandfather figure that, unfortunately, my grandfather's passed when I was either before I was born or when I was very young. And he shared with me war stories. He was a self-made man and owned his own drywall company. And we spent literally hours together, to the point where my cell phone would ring and I would look down and I would see it was Bob, and he'd say, "Honey, I'm in the back of the squad on my way to the Pickering House. Meet me there." He would call my husband in the morning, and they would decide whose day it was to have me that day. So it was just, and when he would go home, he would come for respite to the Pickering House. When he would go home, Denise would afford me the availability to go down once a week while he was back home to see him. And he knew I was only a phone call away. And I cried as if it was my own grandfather when he passed. But I saw the difference we made in that man's life. And the first time he ever came to the Pickering House for respite, and a patient who signs on with hospice, you can come stay with us 5 days a month to allow your caregivers a chance to, maybe they want to take a trip.
Right.
Maybe your care is so intense that they just need a breather. You come and stay with us. He drove himself. And to use Bob's terms, he wanted a getaway vehicle. And not only did he not leave before the end of his 5 days, we couldn't get rid of him. And so the joke was, I'd walk in the morning and he'd tap the crystal of his watch, and if I wasn't there at 6 a.m., I was late.
Oh.
And that included Saturdays.
Accountability.
Yes. He ran his own business. It was a work day. And I can remember many times him saying, I'd say, "Bob, how are you?" And he truly was having breathing problems. But he'd say, "I'm good, honey, but don't tell anybody. I don't want to go home." So, it's just those types of stories that you see the difference. And I think something else that's really important to share, I had a gentleman say to me, he was in the parking lot and he had just lost his father-in-law. This just happened a couple of weeks ago. And he goes, "Well, Susan, people come here to die." And I said, "Tom, with due respect, in some cases that's true. But in many cases, they come here, and that may be what somebody thinks. But once our team of doctors looks at them, and they're able to regulate meds, and they're able to do things, we've given them months of a quality life that they're able to leave here and continue to live life and to celebrate each and every day." So I guess one big message I'd like to share with people is don't fear the term hospice. When it's first mentioned to you, do everything in your power to make an informed decision about what hospice agency that you're going to go with, and keep in mind that it's FairHope Hospice is a good alternative, just in the fact that we provide all types of therapy. It may be touch, it may be aroma, music, pet therapy. And everything that we do to make that patient's day that much better, it's nothing that you're going to be billed for. It's just what we do to make your life a little bit better each day. And another thing that's really important for people to know, there are some home health that when you receive that benefit, you have to be homebound. With us, if you want to schedule a trip, we have a patient right now that got on a plane yesterday and went across the country, and she is celebrating life, and she's with her kids, and she's on a trip. So for us, we don't think that you need to be tied to home. As a matter of fact, if we need to work with another hospice, for instance, in California, we're going to do that to make sure that you fulfill whatever that wish is that you want to do.
That is really neat. I did not know that.
Oh, I can tell you that there's a tagline that we use, and it basically states, FairHope Hospice, we celebrate life. And to see what our social workers and what our nurses and what people do to make sure that those wishes can be fulfilled, you could never place a dollar figure to. It just couldn't happen.
Couldn't do it. And I know that in addition to the patients, the supportive network that you have for family members continues even down the road.
Not only does it continue, but if somebody is given that diagnosis that they have 6 months or less, call FairHope as soon as you can. We have an incredible anticipatory grief program so that we can work with kids. We can work with the parents working with the kids. Maybe the parents don't know how to tell the kids that dad's got cancer and he's going, he's got 6 months or less to live. We'll come in and we'll actually, I always laugh and say, picture just big arms coming in and we're going to just absolutely hug the entire family. There are many times that we can keep that patient comfortable, but in the end, there's really not a lot we can do for them. But what we can do for their loved ones that are left, it's unbelievable. Tracy, our bereavement, the youth and adolescent bereavement coordinator, she has sat down with patients before, and moms are dying, and they're writing letters that she then puts on the envelope. It's their graduation from high school, it's their college graduation, it's their wedding day, and she really sits down and works with the patient on what they want, because they know they're not going to be there. So what can I leave as a legacy for these children? Again, people fear the word, but there's no guarantees if you're given 6 months or less. I mean, I look at Bob, and that was when he called in, and he was with us for well over a year, and we've had people, a 103-year-old patient, sign off of hospice because she no longer needed us. So just because you sign on, there's no guarantee that, that's going to happen. We can get, anything can happen. And you will no longer need our services, and at that point in time, we simply sign you off. And we're always going to be here. You can sign back on again if you need us.
Now, sometimes when you talk about signing on and signing off, does the patient can do that themselves also? But I mean, is it, I guess... You
are not locked into anything when you sign on with us. And we've had patients who get so used to us being there because you're treated so well that they don't want to sign off, but medically we can't keep them on. So, and at that point in time, we can move people back to palliative care, or perhaps they don't need anything.
Exactly.
And the one area we haven't really touched on is the age frame of folks we've helped. We've had from a 3-year-old to 103. So we cover all areas. You were so polite as to point out a little earlier that I am getting older, and now I'm seeing a lot.
I'm never going to let that one down.
No. And the nice thing is, I know JT's got this on tape.
I know. It's okay.
But it's just none of us are getting any younger. And did I perhaps fear the terms hospice and palliative care prior to starting? I think I did. And now it is, Tom and I will be married 9 years in December, and we've updated our wills a couple of times because now it's very real. But I don't fear it. And I think it's pretty safe to say Tom doesn't, because he's heard so much of what we can do, and he has been able to see, whether it's through Bob or Tammy or any of the friends that I've had, the difference we've been able to make.
You make a good point, because I'm sure you've run into people who are like, no, I don't want to hear it.
Or family members who don't want to hear it.
Exactly.
We're going to fight to the bitter end. it's good. It's good for maybe if Tom was saying that about me, come on, Susan, we're going to fight to the bitter end. At the same time, he's got to know that I can't do this anymore. And, I know that's happened before, and with a woman that I know that we're in a chamber together, and her mother just said, I can't do one more treatment. It's time. And the funny thing is, she was about to be hooked up to that treatment. They were there, and she just said, I can't do this anymore. It's time to call hospice.
Do patients do they understand? I mean, do they think, okay, this is
Now,
like you just talked about that lady, but do the patients understand more than the family does?
If you're not alert and oriented, then it's totally up to whoever your medical power of attorney is to make those decisions for you.
Okay.
With every new patient that signs on with FairHope Hospice, we're sending out a social worker to meet with whoever that power of attorney is. And just because we're there doesn't mean that everybody signs on that night, because that's a lot of information. But many times that power of attorney says, look, we need help. We can't do this anymore. And unfortunately, perhaps they should have called us 3 months ago because there was so much we could have done. But again, I think that, and our generation now is not fearing hospice as much as perhaps maybe my parents' generation, because people, much like the gentleman I saw in the parking lot, they hear hospice and they say you're going to die.
Right, exactly.
And as I pointed out to him, none of us are guaranteed tomorrow.
Oh, I know that. Yeah, absolutely. Do you think it's generational? I mean, we talked a little bit about, but we talked about younger kids that are now coming in to see parents that are in palliative care, hospice care. I mean, and you think the younger generation is understanding it?
I think, A, we're doing a better job of getting out to educate people, and B, I think because we're such a tech-savvy, generation, I think, especially when you're talking younger, they let their fingers do the walking, and they realize what services there are that are available to people. And let's face it, so many of us are dual income families that we need help. And I think that our generation and younger, we're no longer afraid to ask for help. Where with my parents' generation and older, you just didn't do that.
Yeah, exactly. Yeah, you're right. Yeah,
and I look at my dad, and he'll do it himself. Nobody mows his yard. Nobody gets out the snowblower and does it for him. And I just think it's just, and now we're more of the generation where it's okay.
Right.
We can't do it all on our own.
Exactly. Yeah, exactly.
And you asked me once about, how I pictured getting involved with this. My grandmother died on our service before the Pickering House was built. And seeing what my mom and my aunt went through in a semi-private room, in an assisted living facility, to know if the Pickering House would have been built, and the room that my mom and Flory would have had we had that facility, it was a good experience that the family went through. It could have been better.
Sure. When you're dealing with, and I know you're trying to educate people as much as you can, do you get a lot of suggestions from people about, well, why don't you have this, or why don't you have that, or is this ever going to happen down the road, or?
I think that if it's in terms of patient care, why aren't we doing this or why aren't we doing that? That is so well covered when the social workers are there, because if somebody's talking about, are you going to do blood transfusions, and are you going to do this, and are you going to do that? They're very clear to explain, this is what we can do, and if it's directly associated to the disease progress, we can't do life-saving treatment. But if they say, you realize, or if you could do this at the Pickering House, or if you, any of those suggestions that are made, we're going to follow up on them.
Yeah.
And patient families are surveyed all the time. They're passed around. We do a Tuesday morning team meeting every week.
You told me about that.
Yes. And the nice thing is, every patient, I don't care how many we have, what our census is that day, every patient is discussed. So not only, and I have no clinical background, yet I have 2 of our medical director's cell phone numbers, and if ever I have a question, I text them and they get right back to me. So the nurses have that kind of contact with all 5, so they're
Right.
getting their questions answered hourly. However, if there's something coming up, they can discuss it with those 5 medical directors sitting there and maybe come up with, and it's amazing, because you might have, of the doctors, and watching their minds work. Have you tried
Right.
this? Have you tried? And then you see other doctors, I've heard that, so it's just amazing. And at the end of the day, it's delivering quality care to that patient.
It's, I know, and we've just got a few minutes left, but I know we talk about, older people, but you have a program for children and adolescents also. Talk a little bit about that.
We do. It's called PALS, Peace, Acceptance, Love, and Support. And there are camps that go on. There are Saturdays that are held at the Y, and anybody that's interested in when the next camp would be, you could call Pickering House. But basically, there are monthly support groups that happen, but more importantly, Tracy Miller, who is our youth grief counselor, you'll see her texting in the Tuesday morning meeting, and many times it's with children who are anticipating the death of someone, or they have lost someone, and she never loses track with those kids. And you never know, at the most bizarre time, it may be somebody who lost somebody 2 years ago, and she's going to hear from them. And it's just, again, the tech-savvy age that we are, it's great for kids to know, I'll ask Tracy, I'll talk to Tracy. And, a great story I have about her, we had a grandmother dying, and her 2 adult daughters came, and the aunt and the mother of the 7-year-old weren't agreeing on whether or not the granddaughter should go in and see mom, who's actively, or grandma, who's actively dying.
Right.
Tracy gets called in, and it's very important. We assume kids are resilient, and maybe we don't need to talk to them about death. It couldn't be, there couldn't be a bigger fallacy out there. We need to have them a part of this.
Right.
And once Tracy was done, it was decided, yes, it was in the best interest of the granddaughter to go in and see grandma. She needed to have some memories of, everything. This child, no inhibitions, crawls into bed with grandma, talks to grandma, does everything she needs to do. And after grandma's passed away, mom and daughter are walking out. She turns around. I'm talking to Tracy in the parking lot. As big as she can, she waves and she says, "Bye, Tracy, I love you."
Wow.
So it's just, that's when I talk about, call us once you have a doctor or somebody suggest you contact hospice, because what we can do with extended family, there might be grandkids involved, there might be great-grandkids involved. We can sit down and really work with them. And when I see that happen, the thing that I see is, upon the death, you see people who aren't leaving sobbing and scared to death.
Right.
You don't want to think that they're smiling and happy, but they know that their loved one passed peacefully and without pain. And they were able to celebrate every moment they could. And those who really hold off to the last minute, we have people who sign on and they're gone in less than 24 hours. We haven't had a chance to work with that family, and that's when you hear the tears and the fear and, what are we going to do? So, as much as you can, embrace it.
We're just about out of time, Susan. We're just a lot of activity. Again, Susan Nixon-Stoughton from FairHope Hospice and Palliative Care has been our guest today. We appreciate you coming on. What's on the agenda for this afternoon?
Doctor's visits. Yes, out and about to make sure everybody has what they need so that they can make an informed choice about FairHope Hospice and Palliative Care.
9 years, correct? Is that your anniversary? 9 years?
Wedding anniversary will be 9, yes.
9 years with Tom.
Yeah, I know. Can you believe
Bless
it?
you, my child.
I was going to say, why isn't I get sympathy cards? What's up with that?
Well, I did talk to a couple people, told me you were coming on the show, and the questions all went back to, how does she deal with, and Tom's an umpire, a football official, referee for years, and how does she deal with when he makes one of those horrible calls and he comes home? How does she deal with that?
It's all on him. I had nothing to do with it. Well, it's the same thing with, you know, depending on how those votes go on city council, that can all be,
That's
you know.
right. Yeah, Tom
But we
was-
agree to not talk about that. If I want to know something that's
No
happening,
politics, no sports,
I
religion.
watch.
no.
I watch LSN if I
Yeah,
want to know.
That's it. Tom has been on council now 6 years.
Longer than that.
Longer than that.
Yeah.
Finance chairman.
Yes.
Does a great job. Does a fantastic
I'm
job.
proud of him. I think he
Yeah.
does. He does pretty.
Well,
All kidding
let's don't
aside.
push it. Let's just well, Susan Nixon, Nixon-Stoughton, apologize. We do appreciate you coming on and enjoy the rest of the day.
Thanks. Thanks for having me.
Thanks for tuning in to this edition of Life's Perspective. I'm Mike Miller, and remember, until we meet again, let's make a difference.
Can you consent with me? Imagine what you'd see if every child had a book to read.
So the mission is for us to get a book to each and every child.
So let's join hands, book people unite, unearth hidden passion. Come on, we'll have a good time.
One book could be the first thing helps to change a life. People unite.
Read to a child today and spark a lifetime of ambition.